Well, folks, welcome to one more edition of Politics Done Right. I'm Egberto, Willies, your host. Thank you so kindly for being a part of the show. We are having a few technical difficulties with our YouTube setup. We'll go ahead and get that cleaned up for tomorrow. For now, it seems like we don't have YouTube access. As I play my first video, I'll try to see if we can take care of that. But for the time being, well, we can't get it done. We can't get it done. Anyway, folks, let me go ahead and get started. Welcome aboard E2247. Welcome aboard Eric Hayes. Welcome aboard. We have Michael Rudden as the dentist. Welcome aboard Yvette Avery Herod. We're going to start again with the dentist and then here the dentist. We're going to start with the doctor and then we'll take it on the other side, and we'll be right back. In the interim, I'll try to get things up. Welcome to another edition of Politics Done Right. I'm Egberto Willies, your host. Today, I'm honored to have Dr. Wilcox. Dr. Wilcox is a doctorate prepared nurse who also holds a master's in health administration and is board certified in nursing informatics. Dr. Wilcox has 28 years of healthcare experience in which he worked as a bedside nurse, hospital administrator, and in healthcare information technology, which has helped him to develop his unique perspective on the American healthcare system. Dr. Wilcox is the author of the book, How to Avoid Being a Victim of the American healthcare system. This is the second time we're talking, and one of the reasons I wanted to have Dr. Wilcox on is we know the issues that are governing us right now. And we understand with the killing of Mark Thompson of United Healthcare by Mr. Mangione, it's a big topic of discussion. Dr. Wilcox, welcome to Politics Done Right. Thank you so kindly for being here.
Thank you, Egberto. It's always good to see your smiling face and to educate the American public on what's really going on in healthcare, especially in a situation where the CEO of United Healthcare, Brian Thompson, was murdered in the streets. So we're going to have a robust discussion today for sure.
Yeah, well, let me ask you this. Without my interference or whatever, what are your thoughts about that incident, specifically that incident and the rationale that Mr. Mangione is using? I don't know if he's in his right mind or what, but the rationale that he's using. What were your initial thoughts?
Well, it's interesting because a lot of Americans have been hurt by the insurance companies denying their care and sometimes even died. So a lot of Americans have a negative view or perspective of the insurance companies. But nobody's ever taken it to the streets, right? So this guy, whether he was in his right mind or not, actually planned this out, knew what he was going to do, and took this fight to the streets. He wasn't even covered by United Healthcare, but United Healthcare is the biggest healthcare insurer in America outside of the government. And so that was his intended target. Like I said, in this day and age, or like we just went through this election, right? Mm-hmm. And people were saying, if I don't get my way, if this candidate doesn't get elected, then all hell's going to break loose. So we kind of have that environment right now in America, but to see somebody act on it the way that he did was a bit alarming. But I can understand why the emotions run each way. If you're somebody who's had somebody die because of the lack of care and the insurance company's denial, or been injured or had a bad outcome because of it, then you're on the side of like, hey, man, maybe this guy did the right thing, right? Not that murder's the right thing ever, but you can understand people's emotions. And then there's people in the other camp who are like, this is terrible for his family, which it is. But more than likely, there are people who haven't been harmed by the insurance company at this point.
I am glad to hear your response in that regard. This morning on my KPFT 90.1 FM program at Pacifica Network, we were talking about that. And, it's a responsibility when one is speaking to a large audience to be careful with the wordiology. And I try my best to do that. But also, I'm glad the measured response that you gave, because a caller called in, and because I made a statement similar to yours, he said, by the way, Egberto, suppose after listening to your call talking about CEOs that causes the dying, the deaths of many of their citizens, suppose somebody listening to you say, yes, I need to do something about that, and they go and execute. Should we blame you? Should we then say you caused the murder of somebody? And I explained the differences in what I do and what the insurance company executives do. And also that, no, we are not asking anybody to go out there and take the matters into their own hands. But I want to ask the question. I brought that up as a precept to ask this question. If you listen to the DA yesterday of New York, the DA of New York, and all the people in the legal community that charged Mr. Luigi Mangiane, they were really adamant that this guy did the wrong thing. He took the law into his hands and he's an evil person. Don't you think that it is high time that the media look at the health insurance industry as a villain that kills and talk to them just the way they talk about Mangiane, who killed that person, who took a life, and the insurance companies that take hundreds of thousands of lives?
Yes, they kill people legally, right?
Right.
Right. So healthcare in and of itself is very personal to the person receiving the care. But the business entities that grow up around that, the pharmaceutical companies, the insurance companies, the pharmacy benefit managers, are there to make a profit off your money. So, healthcare is set up. The insurance companies are hoping you'll pay your premiums, you'll live a good life without any major disruptions health-wise in your life, and you'll die fast. And if you do that, you're fine. If you don't do that and you get a nasty cancer and you want to go to MD Anderson, well, all of a sudden it's out of network, right? Now you got to pay out of your pocket. Or if your doctor wants to prescribe a chemo drug for you that he knows is going to work, they say, no, you got to go back and use this lesser price chemo drug. They have no medical expertise. All they're trying to do is look after their shareholders' profits. But you hit the nail on the head. They legally kill people all the time. Legally, people have negative outcomes and live in bad conditions because the insurance company makes a decision. They control the amount of money that goes out. So much to your point, yes, I do think the media should start to look at them as a business entity who is only trying to make profit and doesn't really care about the patient themselves. I mean, we've seen artificial intelligence used by United Healthcare to deny claims. It's a fast, efficient model. You don't have to pay a doctor. You don't have to pay a nurse to look that claim over. You just use the AI and deny. And what they do is they hope when they deny those claims that you'll go away. But 90% of the people who actually go after those claims, they actually win them. So not a lot of Americans know that they can, go after the claim and take it up to state attorney general and say, I need some help with this. And 90% of the time they win. So these insurance companies know what they're doing. I mean, this isn't, it's not an accident. They're just trying to make as much money as they can. And they're making huge profits at the expense of Americans every day.
And it's amazing that you said they know what they're doing. They know that eventually they'll likely lose the case. But two things happen when they eventually lose the case. The patient, if they were ill enough, could die, at which case nothing is paid anyway. Or as they wait, they're building up time, and they know most people won't go through the trouble, like you said, of doing that. What is really concerning to me as well is that, again, at any given time, I don't know what the percentage is, but let's say at any given time, 2 or 3% of the people are sick in this country. I think that is one of the problems why people don't really see the urgency of the problem. Enough people at one time don't see the urgency of the problem, because if only 2 or 3% of us are really sick that have to interact with the insurance companies at any given time, we have a tendency in our society to be very forgetful of the past once things are over. It's like January 6th happened and everything is okay now. Nobody understands how dire a situation that is. And item after item, issue after issue, it seems like we are, and I don't know if we're designed that way or if the way our society works in America makes us that way. What's your thoughts on that?
Yeah, so I think this guy who committed the murder set off.
Yeah, Mangiane.
Yeah, right. He set off reaction. So as I'm studying this in the American people, I mean, there were people that were elated that he did this, right? I mean, yes. How many times do you see that? People who think he's a hero. So in your January 6th comparison, that happened. There was a lot of bickering back and forth about what really occurred or what the truth was. In this situation, this guy is rewarded for his behavior by some people who say, you know what, they got my aunt, they got my mother, there's insurance companies, about time we got one of them. Right or wrong, that's the way that they feel. But if you look back to things like Columbine, nobody was shooting schools until that occurred, right? And then all you got these copycat killers running around shooting schools, going in and harming children. And what I'm afraid of is that we're going to see a little bit more of this before it's over. That there's going to be people who think, you know what, I'm going to do what that guy did because, my mother died of a nasty cancer and was denied care. So you've seen the insurance companies' reaction to this. They've taken down the bios. Aetna's taken down their bios. Major insurance companies are starting to beef up security for their executives. But why aren't they looking at their model and seeing what caused this? Why America's perception of them is so negative? Why don't they look at their business model? I mean, good God, they're making profit hand over fist. You don't need to make that much profit. You could give back to people who are really sick. It's just an insane model. And it's insane that we as Americans continue to allow it to happen, right? Because our country has some of the worst healthcare ever. And I don't mean that by doctors and nurses. Mm-hmm. What I mean is the system itself. So, we're 17th in quality outcomes in industrialized countries. Right. Yeah. And people are always like, I want to have choice. They don't see what's really going on because they haven't been exposed to different models. It's just crazy. But, when you start to fire up the American public about something like this, you got to watch out because, like I said, if people are calling him a hero, there's going to be other people who are probably thinking right now what they can do to impact the healthcare insurance companies.
It is amazing that you use the example of what I guess the insurance companies have learned a lot from the gun industry. Instead of tackle the problem, double down and solve and prevent it from. I mean, it's like what's the problem to guns? More guns. What's the problem to the insurance? Surround yourself by gun. I mean, it is just amazing how these people think. I read you now. There's another issue that I want to point out to our listeners. To show the evil within, and somebody told me evil is kind of mystic. Maybe it just is the bad within. But you remember the times when Medicare came out. The reasons for Medicare was because insurance companies couldn't figure out a way to make a profit on older Americans. So therefore, they were either insuring them at a very high rate or not insuring them at all. Here comes Medicare. Medicare goes ahead and handles insurance for them, and they give now that they have a backstop, insurance companies say, okay, the government is taking care of Medicare. How can we get our foot in there? Hey, government, for what you're paying in Medicare, give us a fixed cost and we'll take care of it for you now. Suddenly they can afford to do Medicare. I wonder what's the cost of that. Explain the ills of Medicare Advantage versus Medicare.
Sure. So let's just break it down into something that's really basic, a business principle. If you have a CEO that's making $10 or $15 million and is managing your care at an insurance company, why would you continue when you're going into your golden years to pay them to manage your care? Because Medicare Advantage has been shown to deny claims that traditional Medicare would pay. And not only that, Medicare Advantage programs and different hospitals are saying, they deny it so much, we just don't want to work with them. So now if you're an older American and your community hospital says they're not going to take your Medicare Advantage plan anymore, you have to drive 2 or 3 hours to go to another hospital that will take it. It's a scam. Medicare Advantage is a scam. Anytime you can remove the insurance companies from your health care, and you have the opportunity to do that when you turn 65, you should go straight to Medicare. The problem with that is it's very confusing. Like, most Americans don't know what to do. So then we have the Medicare Advantage people bring in these independent counselors, right, that steer you towards a plan with them. Oh, we'll give you a little dental. We'll give you some vision, all that kind of stuff. They're there to make a profit. They're not giving you anything for free. They're there to make a profit. If you go to straight Medicare, then you never, ever have anybody interfere with your doctor and your care. You can go get care anywhere. Medicare pays 80%. You get the gap insurance that goes with it, which is actually an insurance company, but there's different rules at that point. They can't deny care. They just have to pay the 20%. So it's interesting that we have a model that works well for older Americans, and that these insurance companies want to get their foot in the door and continue to make a profit after you turn 65. Steer clear of Medicare Advantage, people.
It is amazing because they didn't want to do it until they had the government to back them up. These are the people that don't want government. Interestingly, even if we take a look at the NHS, National Health Service in Great Britain, now that they're bringing the private sector more and more into their system is getting worse and worse. It was a system that was, again, yes, you wait longer for a hip replacement. That's not an emergency, but it's a system that worked, a system that you never went bankrupt, etc. Now, some of them are attempting to follow some of the U.S. model, a failed model. Now, you wrote a book, and we spoke about this before. And what I want to do here is, because I think if we get people more educated on our healthcare system from people who've been there, who understand it, I think it's essential that we inform folks about it. So anybody who's written a book about what's going on that is a fair and honest book, I want to make sure they have a chance to talk about a little bit about their healthcare within the context of their book. So please go ahead and talk to me a little bit about how to avoid being a victim of the American healthcare system, a patient's handbook for survival, a book written by you, Dr. David Wilcox.
Yeah. So, interestingly enough, when I finished my doctorate, I thought, I have so much knowledge of the healthcare system. I've been in and out of it. I know exactly what to do when an insurance company denies my claim. I know exactly what to do. And not a lot of Americans know that. And so I sat down to write this book because I wanted to give them a handbook. Like, some people tell me, oh, I read the entire thing. It's great. Great knowledge. And some people will say, I bought it and then I had a problem with my insurance company denying me a claim. So I went to the insurance chapter and I read what you had written, and I used some of the loopholes that you suggested, and they actually paid my claim. So I just wanted Americans to be informed. Now, if you go into the American healthcare system and you have no knowledge of it, that's a very dangerous position to be in, because medical errors are still the third leading cause of death. So think about that for a second. And it's not like people want to error, but there's doctors and nurses who are pushed by these insurance companies to see certain amounts of patients. And sometimes they make mistakes. It happens. You just don't want to be on the other end of it. So this book is geared to make you knowledgeable about the American healthcare system. So when you walk in, let's say you're going for an elective surgery, and you bag up your own medications because you read the chapter about going for surgery in the book. And so you bag up your own medications and you tell them, while I'm here in the hospital, I want you to give me my own medications. Boom. You're not getting the $50 Tylenol, right? And the upcharge for that. Or if you're going to get surgery, you want to be the first case of the day, because that's when your surgeon is the sharpest, right? So, and plus you're not going to be able to eat or drink anything. So wait till 4:00 in the afternoon is miserable. But statistics show that first cases of the day do better than last cases of the day. So, all these kind of things that I picked up on my healthcare journey while I was in the business and still am, I just put it on paper because I want to help people. I've heard from a lot of people who said it was life-changing. They knew what to do. One guy told me when he had started asking the surgeon all those questions, are you on call the night before? I want to be in first case of the day. And that surgeon was just like, are you a doctor? And he's like, no, but I'm educated. Uh-huh. So, that book, How to Avoid Being a Victim of the American Healthcare System, you can find it on Amazon. You can also find me if you need a more personal approach at drdavidhelps.com, drdavidhelps.com. I'm out there. I'm here for you. I want to make sure that everybody's educated. And, healthcare is very personal. And so when we have business entities that don't treat it that way, we as Americans need to hold them accountable.
I will have all of that information in the links, because more now than ever, we need a lot of what the knowledge that you've put out there. By the way, I don't remember, is there a chapter on Medicare Advantage in there at all?
No, there isn't. And that's the one thing I've been toying with writing a book about Medicare in general and Medicare Advantage. And, because I get so many questions about it. That's probably the number one question I get all the time. How do I have
a suggestion for you, Dr. Wilcox, a real good suggestion. And that is, your book is already on Amazon. Your book is already in ebook form. Yep. You don't have to just add another chapter, an appendix to that book that you already have written, and just add it in. It's kind of dynamic these times with the way you can do books, because I think that is important. And then re-release the book, because more than ever, we need a lot of what you speak about, my brother.
Yes, I agree with you 100%, especially as people are aging and they don't. Medicare doesn't make it easy to sign up. Let's figure you got to have Part A, B, D if you're using prescriptions, and then you got to get gap insurance. Whereas the Medicare Advantage, the one thing that they do have and they market very well is, hey, no problem, man, I'll take care of you. It's going to cost you a lot less money. Come on over here. You know what I mean? Mm-hmm. But in the end, they are an insurance company. They're there to make a profit. And if you get really sick, you're going to have problems.
Well, Dr. Wilcox, you've spoken to me before. What should I have asked? What should we have talked about that we didn't?
I think we pretty much covered it. I'm hoping that my Columbine theory is wrong, but I just, that the reaction from Americans on both sides of this issue is definitely speaks volumes to me about, I don't think this is going to be a one and done incident.
Well, it's interesting because a plurality of younger folks, and it's amazing that I find it to be that of younger folks. A plurality of them actually are on the side or said that he did. They're lifting him up as a hero for finally giving the system. Our system needs a lot of work, and we're going to have to find a way to do it, and we're going to have to find a way to do it peacefully.
Yes, we are. Definitely agree with you. And also, one thing we should discuss is under the new administration that's coming in, Dr. Oz is a big believer in Medicare Advantage. He holds over $500,000 worth of stock in United Healthcare, at least in 2022 when he had to reveal all that to run for office. So he's going to be pushing to privatize Medicare. So when we start to see that, we need to fight back, because that is the wrong move. That's not a move for Americans. That's a move for profit, to put money in people's pockets and privatize Medicare using Medicare Advantage. So stay alert and stay focused on that issue.
Well, you will be back on again, Dr. Wilcox, because we have to make sure and keep folks informed. We know the mainstream media, who gets a whole lot of money from all these different insurance companies, they will not spend the necessary amount of time. They will mention it, but they won't spend the necessary amount of time on it where people are actually hearing the message. Dr. Wilcox, thank you so kindly. Author of How to Avoid Being a Victim of the American Healthcare System, a Patient Handbooks for Survival, that you can find at Amazon and in the links in the accompanying blog. Thank you so kindly for having been on Politics Done Right.
Thank you. It's always a pleasure to see your smiling face, my friend.
Thank you, my brother. All right, that was Dr. Wilcox, and you heard his statements make a whole Lot of sense. Make a whole lot of sense. Anyway, folks, we have another important video to go, but let me go ahead and read a few things. It's interesting because, as it turns out, Mike Cisak just said, "Oh, this young lady was a leftist." Well, she was given sort of the white supremacist signals on her website. I wonder what does that mean, Mr. Cisak? Well, Mr. Cisak say, Egberto, not according to the writing that they made before the shooting. They are not white supremacists. Actually, the writing that the people are circulating as being from her, it's not known if it's from her. But by the way, we do have the pictures of her with the actual white supremacist sign. So I think you need to be careful with what you're putting out there, my friend. All right, let's see. Again, I don't know where you get your information. Paul Fleming says, Medicare operates at about 2% administrative costs. Private insurers operate at around 30% administrative costs. And if you use other technicalities that they use, my dear brother, it can be even higher than that. Those guys are legal thugs. All right, before I continue, I need to go into brother E2247's numbers. I saw it earlier. Let me find it because I promised that I would keep Gaza on the tips of my tongue. We're U.S. in situation of Gaza. I need to start before that. About 850,000. Man, it's all over the place. So let me get up there. There we go. Day 439 of the war equals 45,097 Gazan killed. That's about 3,339 persons more than on day 365, and at least 107,244 wounded, 10,264 persons more than on day 365, equal 152,341 casualties. That's a shame. That has surpassed the carnage that occurred in Panama. And by orders of magnitude, if you count the population size into account, shame on us for being complicit in this genocide. Yes, we are complicit. All of us are, because we are funding that which gives this. E2247 says, Egberto, thanks for putting up this interview. Yes, it's a very important interview. Paul Fleming says Elon Musk and SpaceX have repeatedly failed to comply with federal reporting protocols aimed at protecting state secrets. Concerns about the reporting practices, and particularly about Musk, have triggered at least 3 federal reviews. The Air Force also recently denied Musk a high-level security access, citing potential security and associated with the billionaire. The guy is, first of all, I don't know if you guys actually know this, but at one point he was in fact an illegal alien. And who told us that? His brother. So let's be clear here. What he's fighting now are things that he's gone through himself. All right. In a flurry of posts Wednesday on his social media, Elon Musk derided a Republican-backed government spending bill that, if not passed by Friday, would lead to a government shutdown. He better watch out, because if the government shut down, he may not get paid, So let's be clear. Anyhow, folks, I have a cleanup of something I did this morning with regards to the IRS. And, well, I tell you what, let me just go ahead and play it for you, and then we'll take it on the other side. As you know, I don't know how you do your taxes, but I have this Willies Media and, of course, the software company that I was placed in hiatus when I started doing activist journalism, and, of course, my personal taxes. And every year it costs me quite a few dollars to go ahead and get TurboTax. That's what I use. But there are several other programs that people use to their taxes. Well, it costs money. And I always wondered, why should it cost money? Some people can't even use these programs that they pay for. They may actually go get a consultant to help them do their taxes. So given that the government is the one who analyzes what type of income you have, etc., whether you need to pay taxes on it, you would think that the government will have the program that they should give you to tell you how much taxes you owe them. So it's a logical thing. And it's something that shouldn't cost money. It's something that the billionaires, right, Jack? Something the billionaires shouldn't be making money off of. I make money off of you paying your taxes. I always thought that was crazy. A company sprouts up and builds a product, charge you for that product, purportedly to make your life easier to file taxes. And the government saw that that was a problem as well. So they decided to create a program, a free program for people who needed to file their taxes. Very logical. Nothing controversial about that. You think? Well, of course, the billionaires got to the Republicans, and the Republicans said, indirect file on day one, says House Republicans. In other words, they want to tell all of the people who don't use TurboTax because, again, either they can't afford it or, they just want to file their taxes. They say the billionaires told their slaves in Congress, hey, guys, we want to continue making money off the backs of the American people. Stop giving them that program that allows them to file their taxes for free. They need to pay the corporations to file their taxes. We need to make money on them filing their taxes. They want to make a piece of they want to turn every service into something that they can make a buck on. It turns out that this is what they said. In a December 10 letter, the lawmakers contend that direct file, which was piloted in 12 states during the last filing session, presents a conflict of interest for the IRS. I mean, that the things that these guys come up with, the IRS collects your taxes. In order for you to file your taxes, it's a complicated process because how many deductions you have, all that good stuff, right? So the IRS makes it simple by creating a program to make it simple, just like TurboTax thought to create a program to make it simple. Now they're saying it's a conflict of interest by the government for the government to tell you how much you owe. I mean, if it's laughable, it is completely laughable. And that they want now to tell, in effect, and this is where Democrats a lot of times fail. Okay. Here we have Republicans telling Trump as soon as he gets into office to cut the program that allows the IRS to give filers a program to make their taxes easier to file. In other words, the Republicans are saying, let's apply a tax. Let's apply a tax to the American people to pay their taxes. Because when they could do it for free, because again, it's the government collecting your taxes, the Republicans are now saying, no, let them pay to file. Let these corporations that make a bunch of money on each one of you tax filers, let them continue to make the money. I mean, can you see this, folks? Can you understand what's happening here? This has nothing to do with conflict of interest. Nothing to do with conflict of interest. It has everything to do with them telling you that you have to pay to get your complicated taxes done. And now the DOGE, which stands for Department of Government Efficiency, they want to look that up as, hey, that's an expense we can cut from the government. In other words, no, they're not cutting that expense from the government. They're taxing you. So I have a message for Democrats. If the papers were turned, by now, there would be ads on air. The Republicans would be running ads on air right now, telling you that the government is taxing you to pay your taxes. And you know what I hear from Democrats? Crickets. Do you want to know why failed policy? Why the party with failed policies win? Because you don't have folks out there informing Americans of the predatory nature of the Republican Party and those who support the Republican Party. So people who are in fact Republicans don't realize that their own party is screwing them. Can you see that? Again, the government gives you the free the website so that you can file your taxes free of charge on the website, but they don't want that. They want TurboTax and all these other software companies that sells you something to file your taxes to make it easier. But I have something for them. Here's what they say. It's less efficient. Well, they forget that for TurboTax to automatically file your taxes, they have to have a gateway to the government computers. You know, when you use TurboTax and it says, are you ready to file? And you say yes, it calls up the government computer, transmit all that information to the government computer, and then the government goes ahead, hits computer, fact checks that stuff from TurboTax, and then says, okay, TurboTax, we accept that filing. Here's what TurboTax is telling you. TurboTax is saying it is okay for the government to spend money to create a software interface to work with TurboTax and all these other platforms, instead of saying we don't need to create that gateway. We just have to present it to the people who are the ones actually paying the taxes. We don't need a middle person. We don't need a middleman. We don't need a middle woman. We can actually go directly to the taxpayer and say, taxpayer, fill out these forms to pay your taxes. It is amazing. It is amazing the thievery sanctioned by our Republican legislature, or the thievery attempted by our Republican congressional house. But you know, it is amazing because when I talk about that party having the proclivity to screw its own, again, they are taxing both Republicans and Democrats when they go ahead and say, kill the program and let TurboTax make a whole bunch of money on you, right? So here we go. The second story that I had today, going to show you how corrupt these guys are. The second story is the USPS challenges already being tested. And in this article at the Daily Kos, what is really happening is in order to make the Postal Service more, in their terms, efficient, what they mean is make a profit. They want to go to the least profitable areas of the Postal Service. Okay, folks, you remember when you saw the election and you saw the map? The map looked very red. The map didn't look very red because most people are Republicans. That's not why the map looked very red. The map looked very red because in those red areas, in most of those areas, only a little bit of people live there. So you have if County A looks red, the reality is there are few people in County A. Then you have a little county called Harris County, and it's blue, surrounded by red. In that little Harris County, there are a lot more people than just everything around it. Okay? So what you have is the Republican voter in the aggregate. They are scattered all over the country in small areas. But here's the kicker. The Postal Service charges the same amount to send a letter to Timbuktu, Yoakum, Texas, or next door to Houston, Texas. All right? Same amount of money. So in other words, those of us who live in Houston, Texas, are subsidizing the letters that go to Yoakum, Texas, because it's very small in Yoakum, Texas. And I'm just using Yoakum as an example. It's very small, and, you know, having a complete mail-in program, the truck going out, burning gas, all of that to service a small amount of people, is inherently inefficient. That is inherently inefficient, but we do it. Why? One, the Constitution says we should. But secondly, because, again, you know, we want our country to be connected. We want our country to be connected. So we make sure that everybody pays the same amount to send a letter to keep us connected. Of course, we use the internet now, but you get the drift. What does DeJoy and the corrupt folks want to do? All those little post offices in those little towns, they either want to close them, or they want to make sure that they don't have to get deliveries every day, or one of these things. In all these rural areas that we're again, it's inefficient to deliver mail. They want to do something about it. But I want to recall something else that we spoke about yesterday. Whereas UPS already doesn't go to ththese rural areas, FedEx already doesn't go to those rural areas. The United States Postal Service does. And guess who uses the United States Postal Service to deliver their mail to the rural areas, to deliver their packages to the rural areas? The good old post office. That good old post office that people think they should hate because a lot of folks are telling you to hate them. No, no, no. Even UPS uses the United States Post Office to deliver their last few miles on packages in Timbuktu, America. And now they want Doge, Department of, it's not really a department, but of efficiency or whatever the hell they call it. Now they are talking about, hey, now we can cut down the United States Postal Service, get rid of those rural areas. So folks, the people who vote for these people are the ones that they're going to screw themselves. You voted rural America. You voted for people who are talking about, guess what? Making sure your deliveries are not on time, making sure you don't get deliveries every day. So they're taking services away from you. You voted them in. People you didn't care about voting for. They're fighting like hell right now to try to make sure all of you get your mail on time, to make sure you get your services. But the people you voted for look at you and say, it's not efficient to deliver to you.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.
Let's be clear here, folks. First, the CSAC. The government loses over $200 billion a year in taxes from wealthy people. And I can actually multiply that amount if we talk about what they're not declaring. Now we can go even further to say that investing in all those IRS workers will more than pay for themselves. In fact, it'll reduce the deficit because, again, of all the tax cheats the wealthy represents. All right. Let's see what else. And as far as Doge is concerned, Hayes, I know that you're not that gullible. If you have somebody like Musk in charge of, Musk in charge of Doge, Musk is one of the biggest suckers of the government's tits than anybody else. He is a welfare king. That is Musk when it comes to what the government gives him. So please, how the hell could he possibly be a good watcher? You guys are so gullible. You fall for the wealthy. You just have to say, I'm wealthy. And you say, okay, how much of my hard-earned dollar do you want to receive? I'll give it to you. I'll give it to you. Anyway, folks, those are the two videos that we had for today. If anybody wants to give me a call, the number is 281-823-7747. Again, that number is 281-823-7747. Give me a call if you want to add anything to the discussion on the two subjects we covered. Actually, we covered three subjects. I am here waiting for whatever or whichever or whomever gives me a call. We are having some technical problems with YouTube today, as well as some technical problems with Substack. I have some emails out to Substack right now. With regards to YouTube, I think I've figured out what the problem is. Unfortunately, we can't solve the YouTube problems without creating a separate event for doing this stuff. But I am going to start looking into creating a what do you call that again? A backup thread to go ahead and connect to YouTube that way at another time. But we'll see how that works out. Anyway, give me a call, 281-823-7747. Can't wait to hear from you. Who wants to call? Bridge MCP is there anything that you'd like to add to the discussion? Politics Done Right from Eric Hayes. Egberto Willies is being slowed down. It's called throttled. I mean, if you take a look at, there are only 42 people right now on this particular platform. There are a lot more if I expand to the other platforms that are listening right now. This is Twitter and the other one. Normally, I should be having several hundred on Twitter, but what can I say? Don't you think AI is going to figure out what kind of words we're using? That's it. All automatic these days, guys. All automatic these days. Anyway, give me a call. 281-823-7747. I think that's the number. 281-823-7747. If you have anything to add to the program. If we don't have anything else to add to the program, I'm going to start to wind us down by asking you to support the station. How can you support it? You can support it by becoming paid subscribers of our newsletter. And how do you become a paid subscriber of our newsletter? You go to politicsdoneright.com/Substack. Again, that is, no. What am I saying? politicsdoneright.com/newsletter. What am I saying? politicsdoneright.com/newsletter. If you want to support us in any other fashion, you can also go to politicsdoneright.com/books to purchase any one of our books. And again, come on, why aren't you working here? Let's do that again. Copy that. Let's go here. Hit that. Control V. There you go. Or politicsdoneright.com/books if you want to purchase our books. Or if you want to find any other form of support, politicsdoneright.com/support. But let me tell you a little secret. You can read all our books free of charge by going to politicsdoneright.com/newsletter, become a paid subscriber, and you get access to all, I repeat, you get access to all of our current books, and even better, all the subsequent books that I write, you will have access to it as well. All right, let's see what else we got here before I close this baby down. Para ver qué más tengo aquí. All right, everything else here is good. Again, please support the station. I got to get out of here because no calls are coming in. And if no calls are coming in, what I'll go do is I'll go repair the issues that we've had with the program. Anyway, folks, love you all. Thank you all for being here. I'm missing a few of our regulars that I don't see, and it's probably because they can't get in through YouTube. Hey, there is Bruce Pollard. Hey, Bruce, how you doing? Maybe they will outsource the states that are losing money. I know, right? Maybe they should do that, Bruce. Good point. Anyway, Bruce, we need to go for some coffee before the holiday is over, man. Anyway, let's chill. My name is Egberto Willies. This is Politics Done Right. And you know how I end this baby. I am what? You know what I am? Out.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.
Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EG
BERTOWILLIES. That is at Egberto Willies. Let us engage. It is politics done right.